Okay, our next speaker, I think, is in the very back. Robin Kehler has been managing the Weeds and Mary Jane's Dispensary in Sechelt for over 4 years. He's extremely passionate about plant medicines like cannabis and superfoods to nourish our bodies, and discussing some of the options and even maybe some cautionary advice from practical experience and customer feedback. Please welcome Robin Kehler to the stage.
Hi, really happy and honored to be here. To be able to bring this plant medicine to the people after a lifetime of prohibition is just really exciting. I've been really passionate about wanting to help people. I've turned my life around after about 7 years of just losing the will to live to now being here and managing a store with the help of using cannabis. Found out I had sleep apnea, was misdiagnosed for probably 20 years. With, anxiety, depression, none of that really. As soon as I stopped taking those medications, my brain cleared up. So what I've seen in the last 4 years since introducing the first dispensary on the coast is people wanting to come in and help themselves. They want to know more about CBD. We'll talk a little bit about THC and of course, what we've heard tonight with regards to youth and using it and where my feeling is on that. But I really want to talk tonight about the benefits of this plant medicine, and not just CBD, but the benefits of using THC too. And we really need to learn to use this medicine wisely and take baby steps. And when they come into my store, I stress to them that the CBD is our go-to medicine. That is what we want in our blood. We want to elevate our blood levels with CBD. I suggest to people that when they come to me, and I'll talk about the one person that I love to talk about who came with both feet in the ground. He had to go and get a tumor removed. He waited 2.5 years to come to me and told me he had to go for chemo and radiation, which I respect. So I said, well, how far are we away? He goes, well, I'm on the wait list. So I said, let's get started. Let's see how much CBD you can put into your body. And let's recognize that we didn't get this way overnight. And our body cells are always wanting to regenerate every 90 days. So let's give our body a fighting chance. And I'm just guessing at this. I don't have an education in this except experience. And with all the people coming back to the store and sharing with me all their experiences. So I'm standing here 4 years later telling you that we've seen tremendous results, because those people who have really taken this medicine seriously, and I'm not just talking about using it as a magic pill and go, oh, I'm feeling a little stiff and sore, I'm feeling a little anxiety today. No, we're talking about people using CBD for the rest of their lives. And yes, 30 milligrams a day works out to about $100 a month. Some of us could look forward to taking less after the 90 days. But what we have seen is this one cancer patient preparing to go for surgery or chemo, worked himself up to 200 milligrams a day, 50 milligrams 4 times a day. And by the time he got into the 3rd month, he actually became so saturated, because it does store in our fat cells, that I suggested that he now cut back to about 50% of where he got up to. So into the 3rd month, he went back down to 100 milligrams. Well, 2 years later, he's still with us, and he's taking 75 milligrams a day. And this is what really concerns me, is that everything I've read on the internet would suggest that we must have THC and CBD together to kill cancer. And yet he's still with us on 100% pure CBD. So the experiences I've been having with these people coming into the store is that they have gone for chemo. After a few treatments of chemo, even though they're taking high doses of CBD, they would get sick. Very sick, because they're poisoning their body. So the ones that have been very successful, from my experience, are the ones that have asked to take a break from the chemo for at least a month to allow the CBD to allow the body to heal itself again. We're seeing people that are healing themselves or coming back to the store and telling us their IBS is either under control or eliminated, or their or their Crohn's is no longer. They've been for a colonoscopy and there's no sign of inflammation. And we're talking about CBD isolate. There's more than one kind of CBD out there. And we've been introducing the new 100%, I call it 99.4 actually, and we have it stored in MCT oil. I asked for MCT oil because I'm a big believer in MCT, medium chain triglycerides and high concentrations we know to be great as brain octane. It's really good for MS, Parkinson's, dementia. It's really, really awesome. So the small amount that's in there, our CBD, is good for a delivery method, not so much for the brain. But nevertheless, the people that are sharing with us that they're literally turning their lives around by finding that they don't share the same anxiety and depression that they used to. Some people have literally got off pharmaceutical medications. I've assisted them to do that because I too have got off those same pharmaceutical medications. Now we understand that everyone's different. Everyone's different with this medicine. We've developed suppositories that are ready to hit the shelves, but I'm not asking the corporation to put them onto the market yet because we need to do more trials. We need to have people try them. We need to have our staff try them because some people do very well with them and others turn green. So we need to find out what people can start with. And I'm a big, big believer coming back to using the CBD. Once CBD is present in the body, we can then look forward to introducing THC. That's what I say to people. Don't come to the store and just want to get on THC because you might not have a good experience. And if they are insistent on wanting to try THC, and especially if they're elderly, I would suggest that we have THC in a coconut oil form, that a person could ingest, yes, but I don't recommend that. I'm suggesting that they put it on transdermally, take it through the skin. It's a long way to go through the blood and then finally through the liver, and that's where, you know, THC delta 9 is turned into delta 11. So that's the psychotropic effect of the THC. So for those who want to benefit from the use of THC, please get the CBD into the body first, and then we start on very small microdosing amounts of THC. And if need be, we start with it transdermally. And we would never suggest a suppository right off the bat. It's just too much. The bioavailability of a suppository is 70%, where ingestion is only 30%. So you're like taking twice as much. Although everything you read would suggest that taking suppositories rectally or vaginally would not cause the same psychotropic effect, we're getting some bad experiences from people. So it's early stages, really, really early stages. Another woman who was preparing for surgery, I love to tell you these stories because it really hits home as to how effective this medicine really is. She was 82 years old, and this woman called me up, my age actually, in her 60s, and said, you know, please help my mother. I mean, she's had 2 hip operations and the left hip popped out, and she's gonna have to wait another 4 months before she gets another hip. The pain that she's in is so excruciating that the opiates aren't working. She's hitting the vodka and the gin. She's not gonna make it off the operating table, she told me. She was heavy, heavy, heavy woman. So we got her on to cutting back the alcohol and worked her up to 50 milligrams a day. Any more than that, she would start feeling pretty robbed of energy, and her health couldn't handle any more than that. And so that's fine. That's as much as she can get into her. And she did 50 milligrams a day for 2 months. And so when she went in for the operation, it wasn't just for the hip, because damage was done from 4 months of walking around on it. They replaced the left knee, the femur, and the hip at 82 years old. Well, she was scheduled for a 4-month recovery in hospital. After 4 weeks, the surgeon came up to her bedside and said, please share with me what you're doing different than everyone else. No one in all my years of surgery is healing as fast as you're healing. I'm thinking of sending you home in 2 more weeks. He did send her home in 6 weeks. Her healing was miraculous. So now when people come into my store, since that happened, and that's a couple of years ago now, you know, I say, you know, if you're planning on going for surgery, now's a good time. Now's a real good time, because it does store in our fat cells. And we're seeing the successes. So all I have to do is be a conduit in my store to see all those people. I have to share with you also that I've sold over 1,400 bottles of this CBD isolate in the last 2 years. So people are coming around and wanting to try this. And they want to try the THC too. And I think it's really important that we respect this medicine and we move slowly. With regards to our store, I'm very concerned about who we're selling to. Memberships have always been very, very important to me. We have a membership because we keep track of people's purchases. And if there's someone that's coming in and purchasing more than what my staff or myself feel that they should be buying, and it's not age, it has nothing to do with age, because we see people my age coming in and buying more than they need to buy. And I question why they can't come back and buy that same product again. Why do they need to buy so much? So we put a restriction on that sort of thing, and if they don't like it, they go shop somewhere else. Because we're walking on eggshells. We're wanting to be accepted by society. We want society to understand that this plant medicine is deserving of being in retail stores. Not just in retail stores, but I've had a dream. I've had a dream about introducing a holistic path of introducing Mary Jane's Holistic Alternative Health Center, which the Weeds Corporation is embracing for me, because I would like to see it go right across Canada. I believe that there's room for nutrition. When people come in and we see the results we're seeing with CBD, I say, well, CBD is just a building block. It's not everything. It's not a magic pill, but it's a good foundational block to help heal our gut. And with that, we're seeing, as I said, anxiety, depression, that starts all here, right in the gut. So with us being able to now introduce CBD, I feel strongly that now we need to be hiring nutritionists. So that's what I have on staff, 2 nutritionists working for us. And we have natural plant medicines, superfoods in the store. And we start talking to them when they come back and they go, well, I'm starting to feel a little better. And now I say, well, let's talk about L-glutamine, let's talk about quercetin, let's talk about licorice. All those things that we need to build a healthy flora. Because without a healthy gut, we're sick. The mind is sick, the body is sick. We can't heal ourselves. And the body is just a miracle. What I've seen in the last 4 years, people turning their lives around, it's because they've made the choice. They finally said, well, I'm not going to be so dependent on listening to everything I'm told. I'm going to go out on my own and I'm going to research my own and try things and experiment. That's what we see happening. And I embrace that. We're seeing more distillates that are being made, and distillates simply mean we have accurate dosing. The Weeds Corporation has tried very, very hard, and successfully, I might add, to raise the bar and set the standard in Canada for tried, true, and tested products. We've got a long ways to go. We still have problems. I'm still identifying problems all the time. There was packaging just the other day that I identified that needed to be clear and rewritten. So we're still moving in this direction of wanting it to be safe for the people. And it really just comes from a passion to have acceptance. And we must tread lightly with this. When they do come into the store, we're not talking just about cannabis. We're talking about what can they do to turn their life around to be healthier. We are talking about good sleep, exercise, eating well. Eating well is essential. We found with the CBD, a lot of people, for example, come back to me and say, well, now that I've been taking CBD, I don't have the propensity after a long day of work. I don't feel that stress. I don't even feel a need to have a joint at the end of the day. Or other people would say, well, I'm smoking way less cigarettes. I don't have that stress. I'm not carrying that stress with me. Alcoholics are choosing cannabis instead of alcohol. That's why liquor and cannabis don't work in the same store. It's never going to happen. So with regards to this being an addictive thing, I have a belief, and I don't believe it's physically addictive. I think people could stop using cannabis. Can't say the same for alcohol. It's psychologically addicting, and if we have an addictive personality, it's pretty darn hard to quit. But a physical addiction, well, my brother has been drinking for 30 years. He can't stop. I've been smoking, using cannabis for well over 40 years. I can stop. I know I'd go through a little bit of a physical adjustment, but it's not ingrained. It's not physically ingrained in me. So I don't personally believe that it's physically addictive. So what we do with CBD typically is start people on a microdosing amount, respecting that everybody is potentially hypersensitive to everything they put in their body, and some people are. So we would say, well, you start with 1 milligram 3 times a day. And then next day you might go to 2 milligrams 3 times a day. Why 3 times a day? We want to maintain blood levels. We don't want to get the body overwhelmed with conditioning to accept it. Most of us, not a problem. But the odd person might just go to 2 milligrams 3 times a day and stay there for a period of time. What we're asking people to do is to work up to about 10 to 15 milligrams 3 times a day. Usually 10 milligrams, that gives us 30. That's a good average dose for most people. After about 90 days, some people would feel to use less. Some people actually clearly need more because some people are very, very sick. The problems that people have had with taking CBD and quitting is they come back to the store and they're not seeing the results. All the people that have come back to tell me it doesn't work for them, it's because they have not been religious about taking it. They haven't saturated their body with it and then just coasted with it. So I can't stress enough the importance of regular dosing of CBD. And if we regularly dose, we don't need to take high amounts. When we start taking high amounts, it literally robs us of energy. And our CBD being 99.4, I don't encourage people to take it at night. Why? We can have very lucid dreams. We may not get the REM sleep. We may not get the depth of sleep we're looking for. Nice, happy dreams, because CBD is an anti-anxiety, antidepressant. It's a mood elevator. So I know my dreams are going to be happy, and which is a nice thing. But if I was to do CBD at night, if I really needed to do it at night, I really need to take THC. And I would make sure I would have as much THC as CBD to balance it out, so that I would at least be sedated enough, just like a sleeping pill, and the CBD wouldn't keep me awake. So that's important to know. We are going to be offering, I think it's important to now introduce workshops at our store. We're thinking Wednesday mornings at 9 until 10 in the morning. We'll call it Wellness Wednesdays for information. The store will be closed. We won't be having it open to the public, and we'll set up some chairs, and it'll be a drop-in situation for people to come in and further talk. Typically, when I talk to someone about CBD and this medicine and introducing them to THC, it could be half an hour to a 45-minute conversation, and it's not always convenient when people are coming in and out of the store, so appointments are really necessary. So either we're going to set appointments or we're going to do the workshop thing, and we'll carry that on until spring, and see how we'll see where that takes us. I did want to touch a little bit on the issue of government wanting to group us into either medicinal or recreational, and I think it's really wrong. I would like to think that my focus is extremely medicinal, and yet we're being pigeonholed into a recreational sort of label. I like to use the word personal. I think people are coming into the store for personal reasons. We need to understand that it could just be that they need to, as the stresses and traumas in their life, and they're not coping well, that they use cannabis to manage their stress and anxiety levels. And they're still functioning adults. Most people that come into my store are holding jobs. You know, I mean, they're functioning adults using cannabis to manage their lives every day, all day long. Some just THC, some CBD and THC. And for myself, for example, I mean, I've used this all my life, and I have a clear driving record. And I can tell you that it's been in my blood all my life. So those of us have to recognize that some people, this is not the right medicine for them. When we're talking about issues of psychosis, and I don't mind touching on that a little bit because I've seen that type of thing come to the store where people are concerned about that, and clearly we steer them away from sativas. I steer them in the direction of CBD-rich cannabis to prevent that psychosis. But we have to recognize one thing. Cannabis nowadays is way stronger than it was back in the day when I was introduced to it. And back then, we didn't try to raise the THC levels up, which automatically drops the CBD levels. So in order for us to now bring these plants back on the market with high CBD levels, we have to focus on raising the CBD and the THC drops. And there has to be this happy medium. We have to understand that we've been really missing out with the CBD by raising the THC levels up in the cannabis. It's not about THC levels. There's so much ignorance around THC. Everybody will come into the store and go, "What's your highest?" "Well, that's 25%. "Well, I'll take that." "Yeah, but that one's not cured. That could have used another week, so you're not gonna get the effect you're looking for. But this one over here is only 15% THC. But that one, the grower left it an extra week. And I can tell you that that's gonna hit you right between the eyes. Oh, that's what I want. So people are really not understanding what's even involved in growing cannabis or the effects of it. Because the same strain could be couchy and sedating, and then someone else or the same grower will grow it again, and it would not have the same effect. So every strain, every one that's on the market is going to have a different effect. Some people find their strain and they stick with it because it works for them. And that's really what it's about. Coming into the store, experimenting, self-medicating and experimenting and trying small amounts and finding what works for you. And at the risk of repeating myself, I can't stress enough about being kind to your body and start with CBD. We all benefit from CBD, and if you want to be introduced to THC, I'm encouraging you to just start with it transdermally and ease into it. Thank you.